Good morning. I'd also like to thank the National Academy of Sciences, and particularly Louise and Allison, for coordinating my not-so-linear travel here from Florence, Italy, where I work at the UNICEF Office of Research, Innocenti. It's a small research office based in Florence in the oldest orphanage in the world, an orphanage designed by the Medici family. And the work that I do there is based on violence against children, and I'm going to take you through. I do like the way the program's been organized in response to your question. I think that the first three presenters, all of whom were really articulate and not using jargony language, which I appreciate very much, we're talking about what we need to do and some of the challenges, and now we're talking more on how we do it. So I'm going to give you some very specific examples from my work on how we are doing this policy uptake in these different countries. So my work in the last 4 years has been on looking at what drives violence affecting children and what can be done to prevent it. And it's a big question because, as Alex has mentioned, we have a lot of data now, not a lot, we have increasing amounts of data looking at the prevalence and incidence of violence. And when I was working as a consultant in East and Southern Africa with UNICEF, we would bring the results of these very substantial CDC surveys and Together for Girls surveys to the governments, and they would look rather appalled at the results that were coming out. And rather than say, I'm going to take action on this, they would look at us, and I did this repeatedly, government after government, they would look at us and they would say, but why? Why is it happening? And it's almost as if you need to explain the why before they will be motivated to take action and move them out of the sort of paralytic mode that they get into, hence the research question. There's 4 studies that are the core studies in this research that I've been doing are Italy, Peru, Zimbabwe, and Vietnam. They were chosen specifically because all of the governments had some interest in one way or another in preventing violence. All of the countries had strong UNICEF offices or UNICEF presence. All of the countries had data on violence, which is really important. And at the point where we were picking this, it's a very purposive sample. I called people like Michelle and Alex in the room and said, we're looking for a country in South America. What would you recommend in terms of quality of data? And they represent, as you see, 4 corners of the world, and both Europe, as well as what we refer to as the Global South, and also 4 different income economies, right? So you have high income, which Italians would argue against now, as we're in a bad crisis in Italy, middle income in Peru, low income in Zimbabwe, and emerging middle or low middle income in Vietnam. So we wanted to see what's going on with violence. Let's get the state of the world's violence against children reports for these 4 countries and see how much it's common and how much it's different between countries. So the research is, I'm just going to take you a little bit through the research background and then talk about the process. The research, which we're just tying up now is of stage 1, was to look at existing data. This was very much of a recycling research project, no new surveys, to look at and do secondary analyses on existing databases, to also do systematic lit reviews, including going in for the literature that was in the native language. That would mean, looking at a PhD dissertation or a master's thesis that was written in Peru on gender dynamics in the rural household of Ayacucho, which is really important to understanding violence, but often never sees the light of day because it's a master's thesis or PhD dissertation. And if it hit the quality mark, then we include it. And then we also did some interventions mapping. And I know we talked about this a little bit early in the morning, that when we looked at about 500 violence prevention interventions across these 4 countries, and only 10 of them were actually evaluated. So that exercise was quite challenging, which is what we find consistently in our field. So after grounding the program, governments and national teams, which is what this is based on, will decide a priority area and type of violence that they want to focus on, because with violence, you've got so many types that it becomes overwhelming for governments. How do we pick where to go in, what sector, what type of violence, what age child, which gender, et cetera? And then we're helping them prioritize through a series of participatory exercises, and then we are helping them develop actual theories of change based on evidence, not on what they think is going on. And then the 3rd stage of this project is the core business of agencies like UNICEF to put these things up and scale them. So that's the background to the study. So what do I mean when I'm talking about violence? And these are all the variables. Types of violence would be emotional violence and physical violence and sexual violence. So we looked at all three, 0 to 18. We also looked at the places where violence occurs, the top one being the home, the middle being the school, and the bottom one being communities, right? So types and places. We were using this socio-ecological framework, which I'm sure you're all familiar with, looking and really focusing on the structural and institutional, because that is where drivers are, right? It's risk factors at the community, interpersonal, and individual, but we wanted to see the sort of potent interplay of these factors at different levels. And then to add to the complexity, which is what this field is all about, is age and gender, right? So you have babies at 0 and children all the way up to 18 under the Convention for the Rights of Children that are affected by violence. And it's different for boys and girls, and it's different by each age. So if you look at that slide, I've presented it neatly with graphics, it's an incredibly complex field to try and untangle, because violence is happening in multiple places with co-occurrence, as Alex had pointed out, in different, at different levels of the socio-ecological, and it's different for boys and girls over time. So to get a government to buy into this is already an overwhelming task, right? And they don't really want to talk about violence, and this was our challenge. So I'm going to give you a little bit about the process. In 2014, we built the research infrastructure in each country. At the UNICEF end, we had a global advisory board. We had one academic partner, and worked very, very hard with our regional offices and our country offices at UNICEF to get them behind this study. UNICEF, speaking of power, has an inordinate amount of power, which can be both dangerous if not effectively used, and very excellent if it's effectively used. So we were able to pull onto that power. And then at the national level, we helped the governments essentially and the country offices vet and create national research teams. And this has really been key. This is not a study that I am doing. This is a study that I am facilitating with my academic partner. We established where the lead ministry would house the study, and then suggested, did not say put up, we suggested committees. So what we did in this first year was really put the infrastructure in place and help countries understand that this is a global issue, not one just in their country. In 2015, the next year, we started analyzing all the data, and this has been a huge task. We have looked at 10 national representative data sets across the 4 countries. We've done systematic reviews of thousands and thousands of articles, a little over 500 actually met the standards. And then we did interventions mapping, which I told you was not very successful. And the whole point of this data analysis was, this second stage was to show that this analysis can be done in country. So the typical role of the international agency is to say, you have a problem, and we'd like to measure it, and we will measure it for you and with you, and then we will take the data to our respective offices in New York or elsewhere in Innocenti, analyze the data, and then send the report back, and if you could write the foreword to that report, it'd be fantastic, and good luck with your implementation. So we wanted to try and reverse that process and really dig deep in the country and build the capacity within, and I'm going to give you an example of how that worked and why it's so absolutely important to working with this very sensitive topic of violence against children. So I'm going to give you the case study of Peru. Now, I have several case studies in Zimbabwe, Vietnam, less so in Italy, of how this process worked and how effectively it's worked. So UNICEF, our main client is not children, our main client is government. So these are the two parties. It's UNICEF, and I would go there on my mission, as they call it, and I would work with the government of Peru, and particularly the Ministry of Gender, which is really where these violence programs and violence prevention is organized. Gender ministries, of course, like social welfare ministries, are the weakest ministries of any ministry. They are under-resourced by far, and they also have very little research capacity. So we're already at a disadvantage. But this is my job. So I arrived in Peru in 2014, and on the way to the Minister of Gender, I heard my colleagues from UNICEF talking about a data source, and I said, well, what data is this? And they said, oh, Kati, please don't ask about the data. And I said, well, what data is it? And they said, well, they did a study on violence affecting children, against children, a school-based study, and they spent $1 million on it, which is why it's the $1 million data. And they had a sample size of 3,000, which was quite robust, and it was a pilot study. So they did it on the coastal area, the mountains, and the jungle. Peru's of like 3 countries in 1 country. They did an extensive pilot study, and they ran the data, and what they found was that 85% of children were suffering from some form of violence. And the reaction was, hide the data. So Peru hid the data. They locked it in a cabinet. They asked me not to mention it, so I kind of used my diplomatic skills and said, I have heard, I'm not sure where, that there's data, and then proceeded to talk about the study. And the response from the minister was no. And that's all it was, no. Straight face. So we continued on to say what we were doing in the other countries and that we hoped that they would join, and we would use other data sets. There's some other good data in Peru. I told UNICEF they needed to regroup and go back and try and get that data, because it's very hard to find good violence data and rigorous data, and Peru's a fairly sophisticated group of researchers doing this work. Second attempt, we discussed how important the data is, and that Peru wasn't alone. There's issues of violence everywhere, as you pointed out, especially in Lacro. And the second response was, no. The results are overwhelming us. It's 85% of the children are suffering, and there's a strong sense of shame and stigma about the data, and they didn't know what to do with it, and they really didn't want to expose it. Third try, I never give up, and neither does UNICEF at the country office level. We went in, and they said, the data can help you if you understand it. We can help you respond to this effectively. And the third response was, sorry, we don't have the capacity, we don't have the researchers, and we don't have the money. And so we regrouped again, and UNICEF knows other ministries, so we talked to the Ministry of Finance on our fourth attempt, and the Ministry of Finance said to the Ministry of Gender, we have the money, just give us the data. As Ministry of Finances are well-sourced and can do these sophisticated statistics. So finally they handed over the data in Peru. And they said to us, UNICEF and the Ministry of Finance, you can have this data, but please make it palatable so that we can put it on our website. Again, another huge challenge. How do you make 85% of children suffering from violence palatable? And here's what happened. First of all, they took the data out of hiding, which was in and of itself a huge research uptake issue. It would have not have been used otherwise, we believe. They grappled with their own national problem, and that was a huge thing. The first indicator of this was early on at an interministerial meeting in Panama. I heard from someone via email that Peru, the country of Peru, one of the ministers got up and said, actually Colombia, Mexico, and Honduras, we also have a violence problem and we're working on it now. So they began to grapple with it and make it public, which was really important. The second thing they did was that they analyzed the data in Peru. One of the caveats of this study was that you don't export data from the country. You do the data in the country. You do the analysis, which means absolute, often capacity building. And that it required statistical refresher courses that we provided with our academic partner. But we did it in situ, and then we did the training in the country and also via the web. So they were, again, holding their own data this time, not having it exported and then looking at the final results. Very, very important. Thirdly, in the middle of doing this, they grabbed their heads and they said, this problem, it's huge. How are we ever going to convince? We now had a small core group of convinced people. How are we going to convince our partners in the government that this is a problem? And the Ministry of Finance said, let's do a burden of violence study, which we heard this morning. So suddenly the Ministry of Finance is saying, hey, let's build on this, right? And they wanted to do that to convince the public of the impact of not responding to violence and not doing violence prevention across all the sectors. So we carried on with our research process, meanwhile, reviewing about 400 existing studies, working with Católica University, and all of this with local researchers. We looked at these PhD dissertations and master's theses. We actually, out of this process, became a lot of nationally peer-reviewed publications, and those are continually being generated now. Very important that the credit goes to the nationals. They're discovering their own problem and going into the peer review, because the imbalance of peer review publications in the North and South is huge, and we're addressing that. We triangulated the data that we were finding with this hidden data with the parallel systematic review going on. And everybody said, whoa, wow, we can't do this on our own in gender and finance. We actually need education at the table. We need health here. We can't explain what's going on in the schools. So naturally and organically, the committee got set up where it became multi-sectoral, because they were handling the data and seeing the complexity of it. And then finally, there was a request for data that came very midway in about the middle of 2015. They called us at Innocenti and they said, quickly, can you do some graphics for us? We want to go into Parliament with the data that we found on corporal punishment. We had been looking at Young Lives data as well, and looking at when children are exposed to corporal punishment. At 8, what happens? And what happens is their math, their verbal, and their self-efficacy rates go down, right? And we know that in the field, but we had evidence now with some longitudinal data from Young Lives. So we quickly, within 24 hours, designed a 2-page brochure. They brought it to Parliament. They had the data, and we actually have evidence that we contributed to the law change, which was passed on corporal punishment using the data from this project. Immediate example of policy uptake before the report was ever written, mind you. This is all about the process that was happening. So that's a good example of what happened in Peru. So what's interesting about this process, rather than the products that I'm talking about, is that this is a typical chain of events, as you know, when you do interventions. You have your inputs, you do your activities, you have your outputs, which is gold currency at UNICEF. Where are your reports? Then you get your outcomes, hopefully, from doing your proper work, and then you get your impact, which is what we're all going for. This project and this research study actually reversed the chain. All right, so we did our inputs and our activities with very little money, mind you, because we were doing secondary analyses, no large surveys. A lot of face time, but other than that, not a whole lot of investment. And then we got outcomes and impact before we actually got the reports. The reports now are coming out 4 years later. I was actually given poor reviews at UNICEF for not producing every year, but I couldn't, because I couldn't rush the national process that was happening. But now there's like 23 products that are coming out all at once, because it's just burst open, giving people the platform and the space and time to do this. So here's an example from all 4 countries of what's happened as a result of this. And this is research uptake. We talked earlier, I think, Alex, you brought it up, about how do you measure research uptake. There is actually an empirically grounded framework that has been tested and being used now by the University of Edinburgh and Sarah Morton. It's called the contributions approach. And we are doing this in all 4 countries with her, evaluating independently the uptake and how it was measured. These are non-tangible things. How do you prove that someone stood up in a meeting in Panama? You know, you do it with an email, and you then call the person and figure it out. So what's happened is, in all 4 countries, we've had national action plans that have been moved and changed by this evidence. In all 4 countries, Italy, Zimbabwe, Vietnam, and Peru, we've actually had budget reallocations for violence prevention research, not implementation research. That is huge. This has been as a result of this process. It ranges from 50,000 to 250,000, which is not insignificant. In 2 countries, Vietnam and Peru, we've had legal law change in the process of doing this. In Vietnam, they developed a child protection creed that is now a multi-sectoral law to address child protection. In this study, we trained a lot of national scientists and built national capacity so that they're quite capable of doing this work now and helping others in the region do this kind of work. And then we have lots of partners, and you'll notice that we have a lot more southern partners. These are all abbreviations, but for instance, the Women's University of Africa in Zimbabwe, many more southern partners than northern partners, addressing that balance as well. So, did we get outcomes? Well, sure. We've got lots of country reports and lots of policy briefs. We've had launches in Peru, in Vietnam, and in Italy. In Vietnam, it was recently launched by the Prime Minister himself, the driver's report, which is in and of itself remarkable. Approved at 10:35 on Saturday night and delivered on Monday morning. So each country is doing their own launches based on things. Zimbabwe is coming along and hoping to launch soon. We've had lots of publications, and these are all nationally authored publications. As I said, it's very important on corporal punishment, social support, all of these different issues. And then, importantly, we've documented how we've done what we've done so that people can replicate this process. So we have lots of toolkits and guides on how to do this research and how to do the social norms work around it as well. So what's trending as a result of this? And this is more about like what you can do when you do something, I think, correctly at the national level. This is another world map looking at the 4 countries, Peru, Italy, Zimbabwe, and Vietnam, and then you'll notice little countries around them. So what happened was that by word of mouth, other countries started joining this process, and what this means is that we're having some meaningful change of practice in the way we're looking at violence at a fairly cost-effective way, all right, across these countries. And to give you an idea of even what's more funny, in the first year of doing this work, I had 15 calls from UNICEF offices. We want to do this work too. I've been doing this on my own with one other person who came last year, so it's been challenging, and I've been very dependent on my national teams. This map gives you an idea of all the countries that are about to start launching this process. So it's a very natural process because it's organic. Finally, I'm almost done, Michelle. I see you waving. So in conclusion, what makes an effective policy approach to actually changing things before you get your final output? One is this human-centered design approach, absolutely critical. Face-to-face time, right, and contact, trusting, building rapport. We have survived 5 government changes within the 4 countries, and it didn't mean anything. You know, people often say, every time I start something, I have to start over again because there was a coup d'etat or a change of government. It was not relevant in this case because we actually built the support from within, not just on the minister, but from within. And we created a lot of new alliances between ministries that did not exist before. The second thing is this issue of national ownership, absolutely critical. I am convinced, absolutely critical. They have to own it, they have to hold their own data, they have to discuss their own data, they have to come up with their own solutions. We really respected the data sovereignty issue, and I think that that's critical, and we trained on their soil, as you know. And then finally, using the data to drive change and having this quick feedback loop where you could turn around quickly. So where we needed to provide technical assistance and do a little 2-page thing for Parliament, we could. But the data had been, you know, they knew their data was there. We didn't have to say, hey, the law is being argued, pull that data in. They actually called us. So we, again, reversed that process. And I think part of it is, I think what George was saying is that it's a solutions approach. I never have once gone to these countries and said, you've got a problem with violence, you need to do something about it. It's like, you know, I work on violence. Do you think that there are any solutions here? And they you know, said no for a while, and then they said yes. So I think this is what's really important. And this is just a short video by a colleague of mine, with interviewing a colleague of mine, how you create this space. This is, oops, how you create this. Where's the little, there it is. Thank you.
I think one of the things that really excites me about the work you've been doing is just seeing how you have worked with governments to take them through a process of self-discovery, using their own data and ownership. And what we know is that people don't act on things they don't feel passionate about. And I think too often we sort of go in and we parachute in, people go in, they study things, and you know, nothing changes, and we ask why. Well, it's because we have to create space for people to go through their own process of discovery around these issues. And I think you've done that remarkably well. And I think that, you know, the other thing that I think UNICEF has is that they have this incredible convening power. You know, I'm always struck with when the UNICEF person comes to a country, you know, they can get appointments I can't get with government officials and the like. And that's an incredibly powerful position, because really, if we're going to do things at scale, we have to be working with governments.
Thank you.
Thank you very much. I'll take just a couple quick clarifying questions, because I'd like to have the next presentation so we can have a robust discussion across the 3. All right, with that then, I think, Holly, would you like to go next? Thanks.